Welcome. I'm Dr. Lauren Tober from the Yoga Psychology Institute, and I'm here with Swami Shankardev and Nanda Saraswati. Welcome.
Thank you, Lauren. Wonderful to be here.
So great to have you here.
Thank you.
Let's start. Can you tell us about yourself? What do you do and where do you do it?
So I'm a Western medical doctor. I graduated from Sydney University in 1976. That's 50 years ago.
Mm.
In the same year before I graduated, I took initiation and became a Swami. And a Swami in our tradition is someone who dedicates their life to the spiritual upliftment of society. I'm also a yoga acharya, a psychotherapist, a yoga therapist, author, and I think of myself as a Jyotish astrologer. And an acharya, just to clarify, is someone who has gained like a master's in yoga or PhD in yoga. And I earned that title after living and training for 10 years at the Bihar School of Yoga in India between 1974 to 1985.
It's interesting that some of the people I've been interviewing started in healthcare and then brought the yoga in, some people the other way around, and it sounds like both have emerged for you at a similar time, have they?
That's right. Well, in fact, my interest in yoga began when I was very young. I was 13 when I bumped into a book called The Third Eye by Lobsang Rampa, and that book changed my life.
At 13, amazing.
I was lucky.
Amazing, you were.
Yeah. Definitely.
And so can you tell us a little bit more about what you studied to get here? You've shared a little bit, but if you go into a little more detail, that'd be great.
Sure. Well, just to complete a bit about me, I think it's important to say that I'm now starting to pull back from psychotherapy, which was what I was mainly doing as a doctor.
I see.
I now only see patients online, mainly focused on teaching, writing books at present, and we teach and write about yoga therapy, philosophy, psychology on our website, Big Shakti. And I do that with my partner, Jane Stevenson. And our focus is basically yoga psychology, psychotherapy, and the deeper dimensions of yoga as a complete system of mental health and self-development. And so, as I said, this really started from a very young age. After that first initial, amazing experience of reading the book and feeling this internal awakening, I was lucky enough to meet several other people who supported me in meeting other teachers. And then eventually I was lucky enough to meet a Swami who told me about Kriya Yoga, which was something I'd really wanted to learn about. That was not the Kriya Yoga of Yogananda, but the Kriya Yoga, the Kundalini Kriyas, which were being taught by Swami Satyananda. And so I went and studied I studied that while I was a medical student. I came back. I was very keen on meditation. I was doing 3 or 4 hours every morning.
Wow.
At the same time, I started doing my medical studies. And that really was very interesting. It really supported me because prior to that, I'd been a bit lost. I didn't feel very connected to medicine. And, I wasn't getting much out of the general social interactions that were going on at that time. There was a lot of drugs and the 60s and 70s was a pretty wild time. I can still remember some of it. But the yoga was a profound experience. It changed my life. And then I decided as I finished medicine that I'd go and live in India. I stayed there. And while I was there, I wrote several books on yoga therapy. They're still in print.
Amazing.
I returned from India in 1985. And I did a Master's of Science degree at the University of New South Wales researching the physiology of yoga. And since then I've done a lot of other studies, Ayurveda. I studied with Vasant Lad in New Mexico. I've done medical hypnosis, and I've got a grad cert in mental health. So it's been a long journey of study. I'm a perpetual student, I guess.
It sounds like it, yeah.
So a lot. It's been, I really enjoy that part of learning, and I have a deep curiosity for it all.
And it sounds like, has most of your yogic studies been through the Bihar School of Yoga?
I have studied with many different teachers from many different traditions, but
Uh-huh.
my heart practice, my heart guru is Swami Satyananda, and his approach to yoga, I believe, was unique. It was
Uh-huh.
very universal. He broke down a lot of the old traditional ways. He bucked the system, and he presented yoga in a way that was extraordinarily practical, and he was
Uh-huh.
able to condense a lot of the ancient texts into very meaningful practices. Yoga Nidra, a lot of his work, his seminal work, that's at the foundation of a lot of the um, yoga schools in today. I mean, basically, there are two schools: the northern schools and the southern schools,
Uh-huh.
and I think they do mesh a lot.
Uh-huh.
Yeah,
Uh-huh. Thank you.
sure.
So you have a medical degree and you work as a doctor, but it sounds like you're working mostly in the psychotherapy realm in terms of healthcare. Is that right?
I work. I used to do a lot of physical medicine, integrative medicine, functional
Mhm.
medicine. I was working with a lot of chronic illness, cancer, diabetes, heart disease, and all of that. But in my later years, I decided to focus more on the psychological aspects, the psycho-spiritual aspects, and my
Mhm.
practice evolved into a more sort of yoga psychotherapy practice, and that went along with this, the kind of teaching we were doing online on our website. So it was a
Mhm.
kind of a mixture of therapy and education, and
Mhm.
sort of evolved in that direction. Yeah, and
Mhm.
I felt that that was important. That was the thing that was missing, that a deeper understanding of the potential in all of us to access um, healing for both the body, mind, and spirit that lives in the deeper psychic systems within us. And so, I lost interest in dealing with just biochemistry, which I love. I think biochemistry is amazing, and
Mhm.
it's the visible um, the visible manifestation of these deeper psychic elements in us, and so that journey into the unconscious
Mhm.
and the ability to access and liberate the power within the unconscious, which is something that drove me personally, and then I guess my practice evolved in that direction.
Mhm. Incredible. So, what does your integration of yoga and therapy actually look like in your work these days? You've mentioned one on one sessions and writing and some online programs. Break that down for us.
Okay, so the way that I integrate yoga and therapy operates on several levels.
Mhm.
In our one-to-one consultations, Jane and I combine Western psychotherapy and mind-body medicine
Mhm.
with yoga philosophy, meditation, and other methods of awakening consciousness. And and I think this combination of Western and Eastern systems is in itself a form of yoga. It's a sort of the harmonious or sattvic union of disparate systems.
I like that.
So, and our primary aim is to help people to become more sattvic, and I
Mhm.
define that as becoming more self-aware,
Mhm.
autonomous, resilient, and capable of intimacy, which I think is a lacking. The heart element has to be developed. Um, and we also aim to help people journey deeper into themselves to discover their hidden strengths and abilities, these that sort of lie dormant. And on the medical side,
Mhm.
we do combine Western medicine. We use herbs and supplements to support people
I see.
on the journey. So that we try to bring it, I'd say that's secondary, but
Mhm.
use those things as well. And then we run a lot of workshops online. We educate people on mental health, especially we have a very strong focus on Sankhya philosophy,
Mhm.
which is the oldest philosophy of India. It's the foundation of all the systems that we study today, all yoga, tantra, the Bhagavad Gita, Patanjali, and it is the theoretical foundation that I believe for emotional regulation and
Mhm.
mental health, developing mental health. Yeah.
Great, thank you. And when you share yoga, what do you actually share? Like what practices, or how are you holding this for yourself, or sharing with with students or clients?
Well, I don't teach asana anymore. I used
Mhm.
to, but I always refer people to asana classes. I
I
think
see.
that's an important part of it, that they find a connection with communities, or people of like-minded um, uh, interests and so on. But we teach a lot of prana and pranic healing
Mhm.
as a way of um, working with the two nadis, Ida and Pingala. Pingala carries in the spinal cord, it carries prana, Shakti, the vital force. Ida carries Chitta Shakti, the psychic force, which is where the psychotherapy comes in. And so this balancing of prana and chitta is the awakening of the central channel, Sushumna. And then that enables consciousness to rise. And with that awakening of consciousness, um, people get a deeper understanding and a different perspective on who they are and what's going on in their lives, and even the deeper meaning of their suffering, why they're suffering, and what they can do. They have their own insight. So it becomes a very wonderful process where we're sharing. I'm reflecting back, and then something emerges from their unconscious. They start to go, "Oh, I get that now." That's become more conscious. And we focus a lot on Sankhya, as I said, the Mahagunas, Sattva, Rajas, and Tamas. I introduced those concepts.
Mhm.
I
Nice.
introduced Carl. I'm very fond of Jung. Jung had a very strong
Mhm.
association with the East.
Mhm.
So we introduce his four functions of mind, a very important way of understanding how to balance thinking and feeling functions. And it integrates well with chakra work, these sort of things.
Mhm.
So there's this Jungian chakra tantric thing that goes on with, which I find incredibly useful. And we use a lot of mantras. So I'm very keen on people having some kind of meditation practice, and this, along with mindfulness, obviously witnessing, uh,
Mhm.
we we use mantras as a way of breaking negative mental patterns and emotional
I
patterns.
see. Yeah.
And let's just say one last thing. We focus on the third eye as a very
Mhm.
important, as the fundamental chakra that governs all the other chakras and
Mhm.
also governs the four organs of mind. So this is where Jane and I worked, trying to use language to describe these very esoteric concepts and make them much more accessible.
Mhm.
Yeah.
Sounds like you're bringing all these different threads together to really support the people you're working with. When you're
Right.
sharing mantra, what
Mhm.
mantras are you sharing?
Well, that depends on who's coming into the room, because, I am a Swami, so already I'm getting a
Mhm.
selected group of
I bet.
people coming in, and
Yeah.
I've got a reputation. I've been around a long time.
Mhm.
So people come to me from a broad range of backgrounds, and um, if and so for some people, I wouldn't introduce mantra immediately.
Mhm.
We would do other work, but the sort of mantras we would use are obviously Om. Chanting is a very nice way to soothe the mind. Soham, a
Mhm.
very non provocative sound, when it's explained properly, is the sound of the breath. And
Mhm.
then for other people, I can move into more who've got an interest in these things. We could use something like Om Namah Shivaya, which is a very commonly used and safe mantra to use.
Mhm.
We use the Mahamrityunjay mantra, Triambakam mantra, often as a healing practice for people once they've gone a bit further onto the path, or they know about this sort of thing. Gayatri mantra.
Nice.
And then occasionally, for certain students who are more advanced, we can select more, unique and specific mantras tailored to their constitution or their interests or their body type. And for that, I sometimes use Vedic astrology to help me understand
Mhm.
what's going on. And that's a very good way to choose a mantra.
Mm. Cool. And I was curious about not teaching asana. What's your reason for not teaching asana anymore?
Um, because I work one on one. I was working one on one,
Mhm.
and I was working in a medical setting. So people would come in for an hour
Mm-hmm.
each week, or every second week, or monthly, or whatever it was. And I wanted to focus. I wanted them to get the asana from other teachers because it's
Mm-hmm.
widely available,
Yeah.
and much better teachers than I am at that. Because they're focused on it, they do it a lot, and they have the space for it. So back in the 90s, I did have a yoga therapy center in Sydney, and I was teaching asana then, but always my particular um, proclivity was to, always get distracted and go into the mind. I'd just go into the psyche and start talking about, what's going on. And then the asana fell away. And then once I let go of that center, I traveled widely. I was traveling throughout North and South America, teaching to different communities. And I was teaching in schools where the asana were all there, and they wanted something deeper. So my guru told me to teach the teachers. That was basically what I was doing, and what I am doing, I think, and to focus on, moving yoga from where it is now, which in the West is very asana centric. So the
Mm-hmm.
word yoga, even for us who live in this world, it has that strong connotation.
Yeah.
Yoga has a strong connotation of asana, and I think part of my work is to try to bring the other systems of yoga into a language that's accessible.
Mm-hmm.
And
Yeah. Okay.
so we're writing so we focus now more on writing books.
Yeah. Okay.
We're going to take all our courses, we're going to put them into books, and
Amazing.
yeah, we'll see where that goes.
Amazing. And are you publishing them yourself, or are they coming through the Bihar?
No, I'm publishing my own. We'll be self-publishing. Yeah, I do have the books I wrote in Bihar are available through Amazon and through other methods. I think you can get them free there's a website from the Bihar school. They now give all their stuff away free. So
Do they? Amazing.
yeah, you can
Oh,
get that online. I can give you the link to that later, and you can help others you can show that to others.
let's do that. We'll put that in your bio under this. Under this. What a great idea.
Great.
Yeah, incredible. So, my next question was, why do you do it in this way? Why do you share yoga the way that you do? And you've kind of already answered that, but I wonder if there's anything else you wanted to add, or does that feel complete?
Um, I think yoga's just become why do I so the question is sort of why do I what?
Why do you integrate yoga into your work the way that you do?
Could not do it any other way.
Mm-hmm.
Just it's become so much part of who I am
Mm-hmm.
that I think I've specialized in that. So, my practice is very specialized, even though, in my medical practice, I'm very boundaried around what I do. I keep it all very consistent with the guidelines from APRA and so on. In my teaching, and even in the medical setting, yoga and meditation are very much now part of traditional or orthodox Western medicine. They've
Mm-hmm.
grown. When I started, there was not much
I bet.
around. I mean, when I started studying medicine, it was very technologically focused because the technology was exploding. The CAT scans were just coming in,
See. Yeah.
and so on. We didn't have all of that. The tech was exciting, so the psychosocial aspects of medicine were not there. Were not
Mm.
appreciated. That only came later. That's now a big part of it of Western medicine.
Good.
So yeah, so I don't think I think over my life. It's just evolved that's my main interest, and so people come to me. They want to deal with a physical or psychological issue, and then yoga is naturally and organically integrated in a way that is ethically based.
great. I'm going to have some questions about the ethics of it. We're going to get to that later.
Sure, sure.
My next question is, how do your clients or patients tend to respond to you sharing yoga? And, this question comes because, everyone listening in today is a therapist and a yoga teacher, or, it varies. Maybe they're wanting
Yeah,
to be or they're studying, but they're wanting to bring these worlds together. And some people have concerns about, well, what are people going to think when I do this? And I think, having a Swami name, people are having some kind of expectation. So perhaps it's a
right.
little bit different when people come to see you, but maybe not. But I'm curious, how do your clients or patients tend to respond to you sharing yoga, whether it's the physical practice or the philosophical?
Sure. Well, I always start my consultations with a normal Western medical history taking,
Hmm.
and um, do all the investigations required for whatever's going on. And most people who come to me already have a lot of that done, and I
Hmm.
work with another GP, or with in a group setting, so that I can focus more on what I really want to do with the psychotherapy side of things in particular. So people are referred from different backgrounds, and some people come with no background at all. Just someone's heard that I'm good at meditation, and they want to learn meditation, and they're facing some existential issue. And so then, we engage in a Socratic dialogue. So we try to work out what's really going on here. What's their background? What's their spiritual, religious faith history? What are they interested in? Some people are very intellectual. They want science. Some people want, a more esoteric approach. And based on that, we just work in a relationship. So sometimes I'll say, are you interested to know a little bit about this? And they'll say, oh, yeah, tell me a bit more. And then, you work over time, you get to feel what's going to work, and you get what we call a yes set. People are nodding, like you're
Hmm.
nodding now.
Hmm.
I'm getting a yes set, which is good.
Leaning in, yeah.
We like that. And so not too much resistance. As soon as we feel resistance, we go, what's going on for you? What do you feel about
Mm.
this? Is this working for you? So it's a relationship. That's why I call it relationship-centered therapy.
Mhm.
And um, people will say, I can't meditate. And I go, okay, that's fine. And so we might just meditate in the room together. I might teach them a 5-minute practice, or give them a very simple relaxation technique. And so it's very much about um, seeing the person and understanding who they are. I think that's the key. And
Mhm.
then, just go from there.
Mhm.
So
Mhm.
I haven't had much trouble. I haven't really, occasionally people will say, look, this is not for me.
Yeah.
Someone's come in an emergency, an acute crisis, and they want something that I'm not able to provide. And then we just say it's not working.
Yeah.
Yeah,
Yeah. So it sounds like it works most of the time because you're really meeting people where they are.
exactly. Exactly. I'm interested in who they are, not in what, I mean, personally, I'd love to give everybody everything, and focus on what I love. But I found that's not always working.
No, it doesn't, does it? Mhm.
No.
But I'm hearing these two themes of one, you following your interest and your passion, your swadharma, and also meeting your patients or students or clients where they are at the same time.
Yeah,
Yeah.
exactly. And look, with some people, I'll just say to them, look, I just don't think this is for you. I don't think I'm
Mhm.
the right person. And I'll say, look, there are these other methods. There's EMDR,
Mhm.
or you need psychiatric support to get the correct medication you need. I'm not,
Yeah.
or I have a great, clinical psychologist around the corner who I work with, and maybe you could do a little bit of work with them. And sometimes they'll send people to me. So we do have a lot of networking that goes on to
Nice.
support people finding what what is interesting for them. Because as soon as they feel that they have a choice, I mean, look, if you go for surgery, you just got to lie down and get anesthetized and hope that that's all going well. But this process that the way we do this sort of work is very much more about self-exploration, self-awareness, self-exploration, self-regulation. What fits with my life? I'm busy, kids, work. I'm at a certain age. I've got these issues, financial issues, or whatever. So there's a lot to consider, and just do the best we can.
Mm-hmm. Yeah. And do you always name that you're sharing yoga explicitly with clients? Like, do you use the word yoga, or do you kind of weave it in more quietly without
Um,
saying the
Look,
white word?
sometimes I will explain a yogic technique in biochemical,
Mm.
through biochemistry or brain science, or
Mhm.
through Jungian insight. Um, Pardon me. And look, yoga is connection. So this process of listening to each other and hearing each other and responding in a way that's respectful and heartfelt, and trying to do the very best we can, that is yoga.
Mm.
That is the essence of connection. And so I think for me the definition of yoga is self-awareness.
Mm.
All yoga aims at the evolution or the elevation of consciousness. That's what yoga is. Everything that we do is about understanding, knowing, feeling, experiencing, and getting it. Oh, I get it. And
Mm.
that's what yoga is. And so the techniques are infinite. There's so many different techniques, and techniques are useful, but ultimately it's consciousness. So, but if I am going to do yoga therapy, I will name it explicitly. I'll say comes
Mm.
from this tradition. I think transparency is essential. When I'm teaching pranayama, I call it pranayama. I say this is a yogic breathing technique. We call it pranayama. Chakra work, obviously, we're into chakras. I mean, there's no getting away from it. I mean, there are people who I think do this kind of work and talk about energy centers.
Mhm.
I'm much more. I'm keen to link what we're doing back to the source, because
Mm.
in my understanding, where yoga came from was an incredibly sophisticated and deep wisdom tradition. And my studies, I'm always gobsmacked at the degree of these texts and what the traditions have to offer. It's so sophisticated, so subtle, and so sublime, that I think in a way, to not give homage to where these things came from is a problem. I think that's going to
Yeah,
degrade the system over time.
agreed.
Yeah, so I always say I'm working with chakras, or this is Sankhya. Look, I'm a Sankhya fanatic, so I'm going, this is Sankhya. And Sankhya has these four organs of mind. The higher mind, just awaken your higher mind. You're stuck in your lower mind, in your manas, in your little
Mhm.
mind. You're stuck in the ego mind. And there's this other deeper part of you, the buddhi-citta, the intellect and the deep wisdom stored in the memory, in the collective unconscious that you can access. And a lot of what you need, you'll feel in yourself, and you'll get things from outside. So we marry. So try to bring that together. And then, as I said, we can talk through biochemistry for some people, or nature. We can use nature symbols, use a lot of symbols. And I'll
Mhm.
say this is a Jungian concept, and so on. So I do like to quote my sources.
Nice. Both, it sounds like, from psychology and yoga
Yep,
lineages. Yeah.
exactly. And I use a lot of transactional analysis. So I tell people, look, this parent-adult child model that I particularly have been using comes from Eric Berne. And then we talk a bit about how to recognize those patterns, how the inner child, the emotions, the desires, the impulses, the joy or the pain or the anger is stored in one part of the ego structure, and how
Mhm.
we have to put this knowledge into the inner parent, and then find an adult that can support a dialogue between the inner parent and the child. So it becomes quite it becomes a psychotherapeutic process, and I will name that.
Mhm. Incredible.
Mm.
Now, when you started doing this work, did you have any early fears or resistance that you needed to move through to integrate the worlds of yoga and healthcare?
So when I first started doing yoga, it was the 60s and 70s.
Mm-hmm.
So it was a very different time.
Mm-hmm. I bet.
Medicine was very different. I guess I was very young and, you know, very driven to move forward on this path, no matter what. But occasionally I did run into trouble, and I learned very quickly to be respectful to all different approaches
Mm-hmm.
in Western medicine, Eastern systems, and so on. So, um, as I said, when I was younger, tech was coming in. Occasionally, I remember talking to one of my as a resident doctor in one of the hospitals. I was working for a plastic surgeon, and there was a woman there who had, I thought, no real physical need for plastic surgery. It was as a young doctor, I had these opinions, and that she may have some more psychological or emotional issues underlying it. And I did ask her a question. I said, is this something you really want to do? Have you looked at what's going on underneath? And
Mm-hmm.
that did come back to haunt me. And I did get a bit of a rap on the knuckles.
I
So
bet.
I was careful after that. Because
Mm-hmm.
psychosocial was not part of it,
Yeah.
you know, then. Um, so I've always had a respect for both systems. I think I've seen living in India, you see how important Western medicine is. I was working with typhoid, TB, leprosy, chronic, tropical diseases. As a doctor over there, I was working in that sort of climate. So a lot of what I was doing was Western
Mhm.
medicine there,
Yeah.
working in groups in NGOs. And yoga was also part of it. We were running yoga camps for asthma and diabetes and heart disease, and we were going to
Mm.
villages and working with poor people and going up into, these major businesses where, you know, high executives were suffering from stress, or, the army, we were working with army or prisons and so on.
Yeah.
So, I, I recognize the tension,
Mhm.
but I don't think it really affected me. I didn't have any pushback. And in my medical profession, I've always had that, as I said, the boundaries are clear. I
Yeah.
understand what works where and how to combine them. And
Mhm.
nowadays, yoga meditation very accepted. So it's changed. Everything's changed a lot
It has. Yeah.
from those early days.
Yeah. And it sounds like the resistance that you had in those early days was not really an internal resistance, but was kind of trying to navigate the systems that you were working in.
Yeah. Look, even though I'm a bit obsessive around all this stuff, I don't think I was fanatic.
I see.
You know,
Yeah.
I think I had it, and I was lucky because my teachers were very wise, and
Mhm.
and so I was very supported in balance, in
Mhm.
not in
Mhm.
aggression, not in egoic expression of who I am and what I think's right. So that learning to listen and relate, that
Yeah.
relational
Incredible.
thing, I think, yeah,
Yeah.
was key.
So, what ethical considerations have you come up against in blending these, several modalities really that you're
Yeah,
bringing together? Can I ask, are you still registered as a doctor?
yeah,
Yeah.
I am
Mm.
still. I think I'm getting close to letting that go,
Yeah.
but I don't know. We'll see. I've probably got a couple of years left.
And doctors are registered under APRA, right? Is that
That's right.
correct? Yeah.
Yeah.
Yeah. So, what are some of the ethical considerations that you need to keep in mind as you're doing this work?
Well, number one, you know, representing a culture, a tradition,
Mm.
um, is high on my list. I think that yoga has to be transmitted. I mean, I think the key is to always be a student, not to be a
Mm.
teacher or guru, because a lot of people, and especially in the West, the commercialization of yoga and these systems, um, it's problematic.
Mhm.
It
Mhm.
it requires the the translation of one cultural system into another culture, obviously it's going to take has its own process. But as I said, I believe very strongly in respecting the traditions, I think, and remembering that I'm a student.
Right.
The second, I think, recognizing the power dynamics inherent in both the doctor-patient and teacher-student relationships. Have to be very careful about that. Both carry real authority, and
Yeah.
that's got to be worked with.
Mhm.
Scope of practice, I think, when I'm working as a doctor, I'm working as a doctor. As a psychotherapist, I'm a psychotherapist.
Ah.
When it's yoga, it's yoga.
So they're very kind of distinct things that you're doing. There's not a lot of blending.
Well, they are. Well, it's like, if I'm using a hammer, I'm using a hammer.
Mhm.
If I'm using a saw, it's a saw, and I might need both to build a house.
Mhm.
But I know if I'm going to use a hammer, it's got to be a hammer. I've got to know how to use it properly. So each system has its own integrity, And,
Mm.
any system has to grow as well. I do think it's important for systems to evolve and
Mhm.
so on. But and I think the problem, in it's working with different systems is remembering that, not to get confused. So because that's a problem.
Mhm.
You'll get into trouble.
Okay, so you are bringing the different the medical stuff and the psychotherapy and the yoga together in like with working with one patient, for example, but that you're very clear on what you're doing at each point. Is that
Absolutely.
kind of it? Yeah.
And with their consent,
Yeah, okay. Yeah.
as part of that, I'm saying this is a meditation practice. This comes from this
Mhm.
tradition, you know, especially, and often the most difficult patients are yoga teachers, like doctors and yoga teachers, because the yoga teachers are
Yeah, it is.
coming in very proud and, very in love with their own system.
Mhm.
And, someone who's very Patanjali focused, well, I love Patanjali and I work with Patanjali, but I'm probably more coming from a different side, from a different tradition. So
Mhm.
learning to navigate how to work with that. But someone says, look, I've got, I want to understand, am I taking the right medication? I'll talk to them. I'll work from that side. Then they'll say, I want to relax more. Okay, here's a technique to relax. This comes from
Mhm.
this. Would you like to do more in-depth work? No. Okay, fine.
Yeah.
Just work with relaxation. Would you like to do more in-depth work? Yes. Okay. So this is a
Mhm.
path. This is what we can do. And these are traditional psychotherapeutic methods, Western psychotherapy, and this is Eastern. And you can blend the two. And meditation is now embedded. Eastern methods are embedded in the West now.
Mhm.
It's all
Mhm.
there.
And APRA, for those listening in who aren't in Australia, APRA is the Australian Health Regulation Practitioner Agency, which doctors and psychologists and many other allied health professionals have to be members of to work. APRA doesn't have any issue with you bringing yoga or psychotherapy into your work when people come to see you as a
No,
doctor.
not at all. No, I've been doing this in fact, I did have someone from the health regulation system talk to me in the early days, because in the early days, doing a lot of long consultations, prolonged consultations, was
Mm-hmm.
unusual. And once they
Mm-hmm.
found out what I was doing, they said, "Are you doing talk therapy?" I said, "Yeah, but I'm doing sort of talk therapy, a bit of meditation, a bit of relaxation. It's all part of the focused psychological strategies item number."
Ah, doctors can do that. I didn't realize.
We have access to that. I am registered for that.
I see. I
Or I
didn't know that.
was. I think I'll let that go now. I think that's
Oh.
one thing, but I was up till now.
It sounds like APRA gives medical doctors much more kind of freedom and scope than they do psychologists.
They do.
Now, which is interesting.
Well, we get a lot of item numbers.
Mm-hmm. Mm-hmm.
Yeah,
Mm-hmm.
so there is a discrepancy. There is a difficulty there.
Yeah.
Yeah.
So, what structures or consent processes do you have in place to help keep your patients and yourself safe? So, you're protecting your registration and
Yeah.
confident that you're working within your scope of
Yeah.
practice.
formal clinical history taking,
Mm.
Socratic dialogue, consent forms, monitoring, doing testing for progress to see, is this person with depression feeling better, on a DAS scale, the diagnostic scale for depression, anxiety, and stress, using all those measures. But consent is written. At the beginning, people come in, they say, "What do you want to do?" Okay, here's the plan. We sign the form, and then we review it, and we review it as we go along.
Okay, so you decide what you want to include and you put that into a written form. Like
Yeah,
what you want to focus on, you put that into a written form and there's
yeah,
that
yeah.
consent at that point. Yeah, great. Thanks. How has this work changed you, both as a practitioner and as a person?
Well, I think as I said, this is I've learned a lot from my patients and students. I've become much more attuned to the other person rather than me. In the early days, I think I thought this is what you have to do to fix people.
Mm.
I think that's gone. I'm now more open to allowing the healing process to unfold organically, and to recognize that, we have to monitor progress. How do we support people? So I think I've become older, a bit wiser, a little bit wiser. Wish I had the wisdom that I have now when I was younger. But it's certainly been the defining journey of my life, And I could never have thought, the journey would take me to where I am now.
Mm. What does your personal practice look like in this season of your life?
Okay, well, when I was younger, I did a lot more practice. Now, I would say I do an hour of meditation, pranayama, mantra practice every day, morning, and then night I do practices. And I've been doing this since 1971 regularly.
Mm.
Um, I like to study esoteric sciences. I study Jyotish, so I use that in my own personal life, to it's a way of understanding karma and destiny, and mainly as metaphor as well, to understand through self-reflection uh, what how to language my inner experience.
Mm.
That's been very useful. Um, I do a lot of writing. I think writing is something that I did when I was younger with my guru, something I was not very, I had no interest in writing when my Swami Satyananda first said to write some books. And after I finished my first book, I said, I'm glad that's over. And he just laughed and said, now I want you to write another book. And I said, Swamiji, another book? He said, yes, another book. And somehow I got the bug. And what happened for me was writing became a sort of a process of allowing my own unconscious to flow through into the work.
Mm.
And, it's a form of self-reflection. It's a form of trying to integrate all the knowledge. You have to express all this knowledge into one form and communicate it. And for me, because as an academic, I can get lost in the academic side of it. So making that relevant to people has been something that, for example, my partner Jane has helped me a lot with. She's much more, she has a greater wisdom with connection with people.
Mm.
So it's been a process of developing, trying to think about what all these things mean, where these systems arose, the different cultures they arose in, how yoga's evolved from the Vedas through the different eras, the Upanishads into, the classical period of Patanjali, and that into Tantra, and then through, the alchemical blending of India with Britain, and how the British, the Raj, transformed yoga into the form we see today, or part of it, and how that's now evolving. So I think recognizing, so my personal practice is, maintaining my center, my ground, my connection to source, and at the same time trying to feel into the world and where yoga's going in the world today. And how do I contribute? And so writing becomes a part of that, and teaching becomes a part of that.
What's one thing you wish you had known when you started this journey, integrating these worlds?
I think the thing, because I'm quite impetuous, I'm quite driven. So I wish I'd known that egoic pushing, and it was doesn't help, and that just relax and it'll all come. Just do the work. And the big difference between having an intellectual map that you can gain pretty quickly, but walking that map, walking the territory of that map, takes a lifetime. So patience, I think. But patience, but at the same time, without being me, I would not have done things the way I did them. So, but definitely, there's a price to pay, but it was worth it for me.
And I sometimes wonder, like the egoic thing that you're talking about, it in some ways it gives us the motivation to get started, right? The impetus to kind of to step into it, and it's a maturity, right? That you're growing.
It's the arrogance of youth.
So what would you say to someone who really wants to bring yoga into their therapy work, but they're still hesitating?
I guess the thing is to study both systems well. Don't, do your workshops, do your courses, but don't settle for that. I think personally, for me, dive into the philosophy, especially Sankhya. I think very misunderstood, not appreciated, didn't get the same, even though it's it's like the brother or the sister of Patanjali. It's the theoretical basis of Patanjali. It hasn't had the same media, press, and so on. I think that's a very important lens that allows us to see the world through the different elements, the four organs of mind, the five senses, the five motor organs, and the five elemental forces, and so on. There's a lot more to it. I think dive into the depths of it so that you have a deeper understanding, not just technique, because technique without understanding, you've just got a kind of a cookbook. And that if you've got the understanding, you know what to apply when. Okay, this works now. And number one, and most important, develop a genuine personal practice, because you can't transmit what you haven't experienced. I think that's probably the most important thing.
Great advice. Thank you. And so my last question for you is, what's your hope or vision for the future of yoga in healthcare?
Well, I guess my hope is that we move beyond the current model, and that yoga in its broadest sense is incorporated more into healthcare, because again, this is the problem with asana and pranayama-based practice alone, that somehow there's a deeper appreciation of the power of the yoga as an umbrella, for an umbrella term, especially what I think of as yoga-tantra, because yoga, for me, I should define it, is Patanjali. That's, yoga is the awakening of consciousness, and tantra is the liberation of energy. And I think in this day and age, techniques that liberate energy, but do it well, do it ethically, do it with boundaried and supported by understanding of how to liberate energy effectively and how to channel that energy. I think that's going to be very powerful as an awakening to what's potential, what's possible. How that then translates into a clinical setting, I don't know, because we're dealing with psychological a deficit in the psychological resources that we have in community. So I think it's a slow process, but my hope is that there's this that a deeper understanding of the of yoga as a complete system of psychological and spiritual transformation, that it's possible, that we understand it's possible. We don't need a lot in our personal lives, but we need to know that it has this potential. The maps of consciousness, explorations of the unconscious, what's unconscious in us. We talk about the unconscious mind, but we're talking about the unconscious body-mind. What's unconscious in the physical body. So the subtle body, the energy body, an understanding that there's something going on. And I think this is where biochemistry comes in, because biochemistry is amazing. There's something magic goes on when you start to see some of these animations of enzymes and so on at work within cells, within mitochondria and so on.
Cool.
I'd love to see a future where every healthcare professional is trained in yoga psychology. As rigorously as they are in cognitive behavioral approaches, and mantras are recognized, that kind of thing, and so on.
Maybe so.
Yep. So that's my wish list. It's a longer wish list than that, but let's leave it there.
We'll start there. That's a good starting point, and we'll work towards the rest of it. Swami Shankardev, thank you so much for joining me today. I really appreciate you coming. I know that you lost your voice last night, and it's back. Yeah, it didn't waver.
No,
thank you so much for sharing your decades.
Only one cough.
Only one cough. Amazing. Miracle. Thank you.
It's a pleasure, Lauren. Thank you.